Good afternoon. This is Dr. Gonzalez. This is the 14th of February. With me I have one of my recent cancer patients that came in. She has been diagnosed since 2006, had some alternative treatments done elsewhere, and so about 10 days ago or so she came to our clinic, and we have some remarkable responses. And I'm going to let her, of course, introduce herself and tell us when you were diagnosed.
Okay. I was diagnosed
Your name first?
Oh, Tina. My name is Tina.
Okay.
And I was diagnosed in April of '06 and spent a couple months researching.
What was your diagnosis?
Oh, HER2 positive, strongly positive.
For breast cancer.
That's right.
Right.
Left breast, one large tumor and two small.
It was stage 1, right?
Stage 1, yes.
Stage 1. And then you chose back then not to do traditional therapy.
Yes, that's
and
right.
you went to Dr. Brzezinski in Houston, who is an alternative, semi-alternative doctor.
Mm-hmm.
And he gave you?
Anti-neoplasm. It's a liquid. It's actually sodium phenylbutyrate, as well as supplements, amino acid supplements that he uses. And I did that in conjunction with Herceptin infusions.
Okay. How many of those treatments did you have?
Because of insurance issues, it was on and off for probably 10 or 11 months.
10 months. And how did you respond to his treatment?
In the first 10 weeks, one tumor was gone, one of the small ones, and the other two were appreciably diminished in a comparative ultrasound. And then I stopped and then started. So, but in effect, I quit doing his protocol. Insurance wasn't paying. And I did Herceptin as a solo agent, and there was no other.
Who was doing the Herceptin for you?
I did it at Brzezinski's. I tried to do it in Dallas with a group, but got kicked out pretty quick.
Was it full dose Herceptin?
Whatever the protocol was. It was
Okay.
at first it was a every 2 week protocol, and then they changed it to every week.
Okay, so it sounds like a full dose. And then you stopped doing anything for approximately 6 to 8 months or so?
No, about a year and 4 months.
A year, 4 months.
Yes.
And then last June of 2008, something happened in your family.
Yes, my father was hospitalized and then into acute care and hospice and then passed away. And over that intervening period of time, I was the primary contact person for everything.
And then in November of 2008, you saw the tumor come back, right?
Yes, by the dimpling effect, I could tell that it was continuing to grow, but it broke through the skin in about late October of '08.
So when you came to see me about 10 days ago or so?
Yes.
It was open all the way. It was down to the cage, to the rib cage.
Well, I didn't know that, but
it was approximately, it was necrotic, and it had a lot of infection, and also a lot of inflammation, and we cleaned it out, started using the K effect, washing it, and approximately 3-4 days ago you had the biltricide to get rid of the parasite.
That's right.
So tell us about that experience.
Well, the pills are fine to take. I didn't have any adverse reactions whatsoever, no dizziness, no problems. And today, 3 days later, and I've only been eating yogurt for the last 2 or 3 days.
The special yogurt that Professor
Yes,
makes.
the special yogurt that is provided, that we make. So anyway, I just now saw some unwelcome visitors, very clear mass of worm-like things in the commode.
Yeah, well, I saw them too. It was really a very large amount of parasites that they passed, about at least an inch long, and it's really truly amazing.
Yeah.
Today, when we made the dressing change, the necrotic smell of the inflammatory disease is gone almost, and we used a combination of number 1 and number 3 water. We washed it with number 3. You drink in number 1 and 2?
I'm on 1 and 2
1 and
now.
2, and you've been doing some enemas.
Yes, that's
and,
right.
and of course,
IV.
we're doing the IV protocol also, the inhaler.
The nebulizer.
And how much improvement have you seen from 10 days ago?
Dramatic. physically, emotionally, just amazing. I used to have to put ice packs on my arm and breast at night. It was so painful. The swelling in my arm was just so bad. I really couldn't use the arm much. The
Well, when you came in, you had your arm
Yeah.
on the side,
Mhm.
like this.
Yeah.
Can you show us? Can you extend your hand right now? See how much you can
Yeah,
move it.
I
Can
can
you-
move
can
it
you
up.
move- can you
I
move
can
it
even
up?
get up here. It got to
Wow.
where I couldn't blow dry my hair. I'd have to go to the beauty shop every
Yeah.
few days to get it
Yeah.
done.
Okay. And your energy? How's your energy?
Oh, I feel great. Oh, really good.
And you lost a few pounds, right?
Is it 7?
7
6 or
pounds.
7, yeah.
And you were carrying quite a bit of fluid on yourself.
Mhm.
You had some problems with your feet also, or did you? Did you have some problems with your,
No,
no swelling on your feet?
no, not my
Okay.
feet. Yeah,
But
just
you
in
did
this
have swelling
area.
on the head. Now
Yes.
that looks about normal, doesn't it?
Right.
Yeah.
And I think we should mention too the PET scan results. I had gone to a traditional oncologist and thinking I would need surgery, but was told surgeons wouldn't touch me. And the traditional oncologist said I just needed to have heavy duty drugs and they could just manage it and extend life. Also, I was given some Flagyl to grind up and put the powder in the open wound, and that was all the treatment I got there. But I was, through the PET scan, diagnosed as stage 4 metastatic because it had spread to the breastbone and a few nodules over here and one vertebra.
Oh, vertebra, yes. And now we're scheduled to also do IPT next week, right?
That's right. We're going to initiate that.
Okay. Overall, the past 10 days, how would you rate Professor Kachetrian's program?
Oh, excellent. I'm just amazed at the results that, has been affected in such a short period of time. And I was so happy to find you,
Well, I'm so happy that the
Yeah.
professor is here to help us.
That's
too, so.
right. I want to drag all my friends and family over here, but I just don't know that they'd understand. they got, it's so amazing, the results, that's why.
Well, okay. Well, it's still early on. Of course, we've got a lot more to go.
Yes, that's right.
But I'm glad you have such a good response. So the pain is completely gone now, or
Yes.
for the most part?
Yeah, for
How
the
many-
most part.
How many days did it take to subside significantly?
Really, in only about 3 or 4 days.
3 or 4 days.
Yeah. And the swelling, too. I was surprised at how quickly the swelling abated.
Mhm. Okay, so you're able to shower
Mhm.
and dry your hair by yourself
Yes,
now?
that's
Okay,
right.
That's good.
Do all those things, too.
How's your appetite?
Well, actually, after eating the yogurt and kind of cleansing my system, I feel so good, and I don't have any cravings anymore for sweets or for, fish or anything else. I guess the primary aspect of this treatment is that I'm a person that's very suspicious and distrustful, but very quickly I could recognize the intelligence level and the capability that I was dealing with here and the sincere caring. And so it was very easy to trust Professor K.
Well, how would you compare in general terms? I know that in traditional medicine we do certain things certain way.
Yes.
Is there much difference between the way we approach the patients and they approach the patients? What do you see?
Yes, this is like medicine probably the way it was done back in the 40s or 50s, where a physician really took interest in the patient, was concerned, worked long hours. The patient was primary. And the doctor who lives up to the Hippocratic Oath, which is first do no harm. And I see the cancer industry in the United States and probably around the world is doing considerable harm, unfortunately.
Well, we hope that we can help you and we'll continue to work with you. And thank you for the interview.
You're welcome.
And I'm sure the professor is going to show your wonderful testimony to his colleagues back in Russia.
Well, great.
Thank you.
Tell them I normally look a little better.
Oh, you